Namaste Dosto, this is Hrushikesh Takbhate from Serum Palace, and in this video I am going to talk about the ongoing COVID-19 vaccination drive in India. So let's start. On 3rd January, the Standards Expert Committee, that is SCC of the Central Drug Standard Control Board, CDSCB, approved two vaccines, that is COVID Shield of Serum Institute developed with the collaboration of Oxford AstraZeneca, then the COVAXIN of Bharat Biotech. Then after the Subject Expert Committee's report, that is SCC's report, Drug Control General of India also approved the use of vaccine for the emergency. Then on 30th January 2021, the Government of India issued a plan, COVID Vaccine Delivery Management Plan across the India to deliver the vaccines to in-need patients. First, let's understand who will get vaccinated first. So I have the list of according to priority. These are the healthcare and frontline workers, persons over 50 years and or with associated comorbidities. Subsequently, the vaccine will be made available to those all others in need. That's the low immunity patients or weak immunity patients, whatever you can say. How can we, the common people, get registered for the use of vaccine? That's right, you need to register for the use of vaccine or to get vaccinated. So let's understand the process. First, you have to register on the COVID official website that is issued by the government, and that is the part of the Vaccine Delivery Management Plan of Government of India. Then we have to upload government photo identity or do an Aadhaar authentication, that is we have to enter the Aadhaar card number and then we authenticate ourselves. Then for that we have to confirm our own identity with the use of biometrics, that is fingerprints, retina or the photo. Then we have to use OTP or the demographics, that is the local authorities. After registration, a date and time will be allocated. Then the prospective district administration will approve the beneficiaries for session and allocate the site. After the online registration, we will receive the SMS in 12 different languages, that is according to our demographics. The message will consist of our phone number, the date of vaccination, the place of vaccination and the time. Then if it gets selected for the vaccination process, then we will get our due doses, that is 2 doses in the period of 28 days. Then we will get the message after each dose of vaccine. Then after the completion of our vaccination process, we will get a confirmation message that we are vaccinated. So do we need any documents for the registration process? Yes. So here is the list of the documents that we will need, any of the following. Like we will need Aadhaar card or driving license or voter ID, PAN card, passport, job card or patient document. Also we can use health insurance smart card issued under the scheme of Ministry of Labour. We also use Mahatma Gandhi National Rural Employment Guarantee Act, that is MGNREGA. We don't need that. Official identity cards issued to MPs, MLAs and MLCs. We are not one of them. Passbook issued by bank, post office. We can use that. Service ID card issued by central, state government, public limited companies. Then we have to remember the one note, that is photo ID is a must for both registration and verification at the session site to ensure that the intended person is vaccinated, so that the other cannot get vaccinated on our own Aadhaar. Then what precautions are required at the session site? We must rest at the vaccination center for at least half an hour after taking COVID-19 vaccine. Then inform the nearest health authorities, ANM, ASHA, in case you subsequently feel any discomfort or uneasiness. So here's the note. Even if we get vaccinated, we have to remember the following COVID appropriate behaviors like wearing masks, maintaining hand sanitization and physical distancing. That doesn't mean if we get vaccinated we can roam freely and do what we want. So how many doses we need? So as stated earlier, we need 2 doses of a vaccine after 28 days. So the main question, when would antibodies develop after taking the dose? Protective level of antibodies generally develop 2 weeks after receiving the second dose of COVID-19 vaccine. Hence, first we have to get vaccinated for the first time, that is 1 dose of vaccine. Then after 28 days we will receive the second dose, and after that 2 weeks later the antibodies will start to develop in our bodies. So we have to rest at least 2 months So we will take the 2 months period to develop antibodies in our body even if we vaccinated. Now, how will the vaccine will be delivered across the India? Well, for that the government has the government medical store depot, that is GMSD, in 37 places all over the India. There are 4 primary stores that are located in Karnal, Mumbai, Chennai and Kolkata, that is 4 corners of the India. So that's for the video. If you like this video, please like, share and subscribe. All the information in this video is given in the description, so if you didn't understand any of part of this video, read this description carefully. Also, I made a 3-episode series about the vaccination process, like how the vaccines are made, how the vaccines are approved and how the vaccines are distributed. So if you want to check that out, check in the I button. And lastly, thanks for watching. This is Hrushikesh Takbhate from Serum, signing out.